History of Borderline Personality Disorder, BPD, Evolution of the concept of BPD in psychology. The concept of borderline personality disorder, BPD, has evolved significantly over the course of the 20th century, with shifts in both its understanding and treatment. What began as an ambiguous and poorly defined condition has gradually become a widely recognized and researched disorder, with growing attention to its psychological, emotional, and neurobiological underpinnings. In this episode of the Borderline Personality Disorder, BPD, podcast, we explore the evolution of BPD in psychological theory, tracing its development from its early conceptualization to its current understanding in both clinical and research contexts. Early understandings and psychoanalytic theories. The roots of BPD can be traced back to the early 20th century, when psychoanalysis was the dominant framework for understanding mental illness. At this time, individuals exhibiting symptoms that did not neatly fit into traditional categories of psychosis or neurosis were often seen as having borderline conditions. In the 1930s, Adolf Stern was the first to use the term borderline in a clinical context. Stern identified patients whose symptoms appeared to lie between neurosis and psychosis, which were the main categories for understanding mental illness at the time. These patients displayed emotional instability, difficulties with self-identity, and issues with interpersonal relationships, but without the full-blown psychotic episodes seen in conditions like schizophrenia. Stern's work laid the foundation for what would later be called borderline personality disorder. During the mid-20th century, psychoanalysts began to develop more nuanced theories to explain these borderline states. Otto Kernberg is one of the most influential figures in the early psychoanalytic understanding of BPD. Kernberg, working in the 1960s and 1970s, conceptualized BPD as a disorder of the self and emotional regulation. According to his theory, individuals with BPD experience difficulties in integrating different aspects of themselves, leading to unstable self-esteem and unstable interpersonal relationships. Kernberg emphasized the importance of early childhood trauma, particularly emotional neglect or abuse, as a contributing factor in the development of BPD. This psychoanalytic framework posited that individuals with BPD had an unstable sense of identity and were prone to intense emotional swings. They often experienced what is called splitting, a defense mechanism where they viewed others as either all good or all bad. This idea of splitting was seen as a way for individuals with BPD to cope with intense emotional conflict, and it remains a key concept in modern understandings of the disorder. The birth of borderline personality disorder as a diagnostic category. The real turning point for BPD came in the 1980s when the American Psychiatric Association, APA, officially included borderline personality disorder in the third edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-3, published in 1980. This was the first time that BPD was formally recognized as a distinct mental health disorder in the clinical community. The DSM-3 provided clear diagnostic criteria for the disorder, marking a departure from the earlier psychoanalytic interpretations of BPD. The criteria for BPD included a pattern of instability in interpersonal relationships, self-image, and emotions, as well as impulsive behaviors that began in early adulthood. This formal recognition of BPD helped solidify it as a valid and diagnosable disorder, and it was now viewed through a more structured, clinical lens, focusing on observable behaviors rather than purely theoretical concepts. At this time, BPD was still primarily understood through psychoanalytic lenses, and treatments focused heavily on long-term psychodynamic therapies. However, with the advent of more standardized diagnostic criteria, the stage was set for more diverse treatment options to emerge. The rise of cognitive and behavioral models. By the 1990s, a shift occurred in the treatment and conceptualization of BPD. Cognitive behavioral approaches, which had become more prominent in the treatment of other psychological disorders, began to influence the understanding of BPD. One of the most important developments during this period was Marshall Linehan's creation of dialectical behavior therapy, DBT. Linehan, a psychologist who had worked with individuals with BPD, found that traditional therapeutic approaches were not effective for many patients with this disorder. In response, she developed DBT, a form of cognitive behavioral therapy designed specifically for people with BPD. DBT focuses on helping individuals regulate their emotions, develop interpersonal skills, and learn acceptance strategies. This therapy, along with other adaptations of cognitive behavioral therapy, proved to be a breakthrough in treating BPD. DBT and other cognitive behavioral treatments represent a significant shift in how BPD is understood and approached in clinical settings. These therapies emphasize the importance of skills-based interventions and the regulation of emotions, contrasting with the earlier psychodynamic focus on understanding the unconscious conflicts that may have led to the disorder. In addition to DBT, other therapeutic approaches, such as mentalization-based treatment, MBT, and schema therapy, emerged in the 1990s and 2000s. These therapies also focused on improving emotional regulation and interpersonal relationships, offering new avenues for treating individuals with BPD. Neurobiological insights into BPD. As research into BPD expanded, the 21st century brought greater emphasis on understanding the disorder through a biopsychosocial lens, which incorporates both biological and environmental factors. Neuroimaging studies began to uncover structural and functional differences in the brains of individuals with BPD, particularly in regions responsible for emotional regulation and impulse control, such as the amygdala and the prefrontal cortex. The growing body of neurobiological research suggests that individuals with BPD may have heightened sensitivity to emotional stimuli, making them more vulnerable to intense emotional reactions. This aligns with the clinical picture of BPD, where individuals often struggle with emotional intensity, impulsivity, and difficulty controlling anger or sadness. In addition, research has identified links between childhood trauma and the development of BPD, particularly experiences of neglect, abuse, or instability. This has led to a more comprehensive understanding of BPD, where both genetic predispositions and early environmental factors are recognized as contributing to the disorder, shifting perspectives and decreasing stigma. In recent years, there has been a significant shift in how BPD is viewed by both the public and the mental health community. For a long time, BPD was stigmatized, with individuals suffering from the disorder often labeled as manipulative, dramatic, or difficult. This negative perception was further compounded by the historical focus on psychodynamic theories that viewed individuals with BPD as resistant to treatment. However, with advances in research, more effective treatment methods, and advocacy efforts from both professionals and individuals with lived experience, BPD is increasingly seen as a treatable condition. Today, many experts and clinicians emphasize that with the right support, people with BPD can experience significant improvement in emotional regulation, relationships, and overall well-being. Conclusion. The history of borderline personality disorder, BPD, reflects an evolution from a vague and poorly understood concept to a well-defined mental health disorder that is increasingly recognized for its complexity and treatability. From its early psychoanalytic foundations to the development of effective therapies like DBT, the conceptualization of BPD has grown more nuanced and evidence-based over time. As research continues to explore the neurobiological and genetic factors contributing to BPD, and as societal attitudes evolve, the hope is that more individuals with BPD will be able to seek help and receive the support they need to lead fulfilling lives. Stay tuned for more episodes as we continue to explore the complexities of BPD and the advances in treatment and understanding that are making a real difference in the lives of those affected by the disorder.